Okay, welcome back guys. Now, in the second video, let's discuss about the action potential of an SA node. Okay, we have discussed that SA node is a pacemaker of the heart. It is going to undergo self-depolarization. See, try to understand something like this. There are two sets of students. Okay, so one is self-motivating. Okay, he is going to motivate by himself and he will come and motivate the other person. The other type of students, they cannot self-motivate, they need to have an external stimulation. Now in the same way, our pacemaker cells, they will undergo self-depolarization. Automatically they will undergo activation. Okay, that's why they are called as the pacemakers. They control the heart rate, out of which the SA node is the pacemaker of the heart because it's producing the maximum number of action potentials. So now let's see SA node action potential, how the action potential of the SA node happens. Okay, see, the SA nodal has a pacemaker potential or restless membrane potential, okay, which is at minus 60 millivolts. Okay guys, please look at here in this graph. What I am showing you is the SA nodal action potentials. Now see, let's start from the minus 60. The SA node, okay, that one particular cell is having a membrane potential of minus 60, but it is not constant. It is not constant. See what is happening? This potential is moving towards positive side. Am I right or not? Now minus 60, it is gradually becoming minus 40. Minus 60, it is becoming minus 40. Means getting little bit positivity into the cell, right? From minus 60, it is getting minus 40. So now cell is moving from minus 60 to minus 40, or I can say the membrane potential is moving towards positive side or towards threshold. Now you can ask me, sir, why this is happening? Why the membrane potential is not resting constantly at minus 60? Why it is moving towards threshold? Now let me show you here. Imagine this is SA node. Okay, this is SA node. Now this SA node, because of the sodium potassium ATPases, okay, there are channels called as sodium potassium ATPases. What the sodium potassium ATPases are doing, they are throwing the sodium ions out and bringing the potassium ions in. Okay, see, more sodium are going out, more positivity is going out. Cell is all the time losing the positive ions and getting only less number of positive ions in. So more loss of positivity, so cell will become negative inside. See, this only contribute for a very less change, only minus 5 millivolts, not minus 60, minus 5 millivolts. It will create a negative membrane potential of minus 5 only. But what I want to put into your mind is, sir, on this SA node, there are these channels. Please look at these channels. What are these channels? These channels are called as the leaky potassium channels. They are leaky potassium channels. Remember, all our body cells have highest concentration of potassium. Potassium concentration is more inside the cell. So what potassium will love to do? Potassium will move out from high concentration to low concentration all the time, 24/7. Potassium is going out, which means positive ions are going out. When the positive ions are going out, what happened to the potential inside the cell? It will become minus. So now it is at minus 60. Okay, minus 60, negativity is there inside the cell. Why? Because positive ions are moving up. But what happens? Okay, what happens to this SA nodal cell is, sir, on this SA nodal cells, there are some special channels present. Okay, there are some special channels present which are not seen with the ventricular myocyte. These are not present in the ventricular myocyte or atrial myocytes. Now, what are these channels is? These channels are called as the leaky sodium channels. Leaky sodium channels. Okay, they are IF channels or HCN channels are also called as LEAKY, leaky sodium channels or funny channels. Okay, funny sodium channels. Now what they will do is, for every 0.8 seconds, what happens is, sodium is coming in. Okay, sodium is coming in. Now when the sodium is coming into the cell, what exactly is happening? Positive ions are coming in. When little bit amount, little by little, positivity is coming in. So what happens? Now from minus 60, the membrane potential will move to minus 40. Okay, now this is restless membrane potential, right? Resting means if it is there constantly at minus 60, that is called as a resting membrane potential. But this is a pacemaker potential which is not resting, it is restless. All the time from minus 60 it will go to minus 40 because of the inward movement of the sodium mainly. But also remember one more important point, there are also some channels called as the calcium channels which are T-type calcium channels. T-type, T means transient calcium channels. Even through via these transient calcium channels, some amount of calcium will also come. Now calcium is also a positive charge. Sodium is also a positive charge. So as the positive charges are coming into the cell, into the SA node, now cell will undergo activation. What kind of activation, sir? The membrane potential is moving from minus 60 to minus 40. Important point is, see, whenever the SA nodal potential inside the SA node, whenever minus 40 is attained or achieved, immediately on the cell, on the cell surface, some new channels are going to open. Already these channels are there but they are closed. Now whenever there is minus 40, now these channels will open. These channels are called as calcium channels. Voltage gated calcium channels. These calcium channels are sensitive. These calcium channels are sensitive to what? They are sensitive to voltage. Which voltage? The voltage inside the cell, the voltage inside the SA node. Now whenever minus 40 is attained, immediately these calcium channels are going to open, which will cause entry of calcium into the cell. Which will cause entry of, let me show the calcium with yellow color. They will cause entry of calcium into the cell. So lots and lots of calcium will enter into the cell. Important point is, so these channels, these are not the T-type calcium channels, these are L-type calcium channels. So long-standing calcium channels. Calcium comes into the cell will undergo depolarization. Now let's see all these events in the graph. Guys, please concentrate. From minus 60, the membrane potential have to go to the minus 40. So what is this stage called as? What is this area which I am showing you? This is the phase 4 of the action potential. This phase 4 is actually restless membrane potential or pacemaker potential because of the influx of the sodium through the IF channels or HCN channels or funny sodium channels or leaky sodium channels. So this current is also called as a funny current. This current is also called as a funny current. See, please concentrate. Slow influx of the sodium. Because of the slow influx of the sodium, this movement is happening from minus 60 to minus 40. Now once minus 40 is attained, see this red color graph which I am showing you, this red color graph is nothing but the depolarization phase, the phase of phase 0. Phase 0 is the depolarization. Now depolarization is because of what? Depolarization is because of the rapid influx of the calcium through the L-type calcium channels. Now later what happens? Now after depolarization, after some time, when the positive potentials are attained, now what happens is, see, this calcium influx decreases. Calcium is not coming into the cell. Now what is continuing? All the time potassium is going out. So what happens? As the positive charges are not coming in and positive charges are constantly going out. So what happens? Again the membrane potential will again come back to minus 60. It will come back to minus 60. So this is phase 3. This is depolarization. Not depolarization. This is repolarization. Phase of repolarization. It's because of the outward movement of potassium, or it's because of the efflux of potassium. Due to efflux of potassium, repolarization will occur. So a calcium entry into the cell decreases. So how many phases are there? This is phase 4. There is a prepotential or restless membrane potential. There is a depolarization and there is a repolarization. Now after this, let's see what are the questions which you need to know for your exam. Sir, how many phases are there? Prepotential, depolarization, which is phase 0, and repolarization, phase 3. What are important points? See, this prepotential is actually oscillating. Okay, it's oscillation of the resting membrane potential in the SA node. It's like oscillating means moving. See, what is happening in the prepotential phase? In the prepotential phase, the resting membrane potential, I shouldn't say resting membrane potential, but okay, just for convenience, the membrane potential is moving from minus 40 millivolts to minus 60 millivolts. And what are the ions responsible? Why this is happening? So this is happening because of the funny currents. First important point, this is because of the funny currents. Okay, so what is this funny current? This funny current is because of the entry of sodium ions into the cell, because of the influx of sodium, also because of influx of calcium ions via transient calcium channels. Okay, via transient calcium channels. Important point is, during this phase, potassium efflux also decreases. Okay, so there is a decline in potassium current. The potassium ions, whatever are going out of the cell, okay, actually decreases. So positive charges are not going out. Rather, now positive charges are coming in. Sodium is coming in, trickling into the cell. Calcium is trickling into the cell. Okay, so these are the events which happens in the prepotential. Now, during depolarization, depolarization is all the time phase 0. Now, depolarization is because of what? It is primarily because of the inward calcium currents through the L-type calcium channels. And repolarization, depolarization is primarily by the efflux of potassium ions through the delayed rectifier potassium channels. Okay, so these are the points which I want you to know. Now, after saying this, now let's discuss about the effect of autonomic nervous system on pacemaker potential. How autonomic nervous system is going to affect the pacemaker potentials? Now, how many types of autonomic nervous system do you know, guys? There is autonomic nervous system, in the sense, see, autonomous activity means involuntary activity. Your heart rate is not under your control. Okay, there are two types of autonomic nervous system: sympathetic nervous system, parasympathetic nervous system. Sympathetic nervous system increases the heart rate. Parasympathetic nervous system decreases the heart rate. How this will happen? Now we will see. See, sympathetic nervous system, whenever there is sympathetic activity in your body, what it will do? It increases the heart rate. So, increasing heart rate is called as a positive chronotropic action. Chronotropy is the word used for heart rate. If I say positive chronotropy, heart rate increases. So, sympathetic nervous system is acting. How it is acting? It is a positive chronotropic agent. Sympathetic nervous system, by producing the epinephrine, it increases the heart rate. What it will do? Sympathetic nervous system releases neurotransmitter, epinephrine or adrenaline. Now this neurotransmitter, what it will do? In the SA node, it increases the CAMP levels. The cyclic AMP levels are activated. So what the cyclic AMP will do? So cyclic AMP opens the funny currents, opens the leaky sodium channels. Whenever the leaky sodium channels are activated, more and more funny currents are going to enter into the SA node. So what will happen? Now see, please concentrate, guys, in this graph. This green color graph is a normal graph. Normal. Okay, there is no sympathetic activity or no parasympathetic activity. This is normal action potential in a person who is absolutely calm and relaxed. There is no sympathetic activity, no parasympathetic activity. Now, whenever sympathetic activity happens, what I have explained to you, CAMP level increases in the SA node. Whenever CAMP level increases, now more and more funny currents are coming into the cell. When more funny currents are coming into the cell, it will take very less time. It will take very less time for the movement from minus 60 to minus 40. Okay, see, for every 0.8 seconds, threshold is getting attained. For every 0.8 seconds, one depolarization will happen. But now, just for every 0.3 seconds, now, what will happen? Depolarization will happen. So, what I am trying to put into your mind is, see, sir, this prepotential phase, see, it's now taking 0.8 seconds from starting from minus 60 to enter into 40. Actually, here this is minus 60. Okay, now let's write it down from minus 60. From minus 60 to go to minus 40. Normally take how many seconds? 0.8 seconds. Okay, let's take it something like that. But now, this movement is taking, see, whenever there is sympathetic activity, now this event is happening in a very less time. So slope is increased or not? Slope is now increased. From when compared to this, now the slope is increased because of the fast movement of sodium through the leaky sodium channels. okay, or funny sodium channels. So what happens now, in a very fast time, action potential is completed. Okay, now exact opposite thing is the parasympathetic nervous system. Parasympathetic nervous system, by producing the neurotransmitter acetylcholine, what it will do? It will decrease the heart rate. So negative chronotropy. What it will do? What it will do? How it decreases the heart rate? It opens the potassium channels. When the potassium channels are open, potassium is going out of the cell. Why? Because intracellular potassium concentration is more when compared to outside. So potassium all the time wants to leave the cell. Potassium wants to leave the cell. So potassium is a positive charge. So continuously positive charges are going out, going out, going out. Positivity is going out. So now cell is inactive. Okay, cell is inactive. Now it will take a lot of time for the movement of membrane potential from -60 to -40. See, that's what I have shown you in the image. See, in this orange color graph, now it is taking a lot of time. Why? Because cell is having negativity. Okay, now it will take a lot of time for the moment, for the threshold to attain. So what happened to the heart rate? Heart rate decreases. So remember, parasympathetic nervous system opens potassium channels, leading to increased efflux of potassium ions, which will decrease the slope of pre-potential. Now it's taking a lot of time for the pre-potential to reach the threshold. Okay, so we have discussed the effect of autonomic nervous system on pacemaker potential. Okay, sympathetic nervous system increases the slope, completes the action potential in very fast phase. Parasympathetic nervous system opens the potassium channels, decreases the slope of pre-potential. So if pre-potential is taking a lot of time, so heart rate decreases. Okay. Now after this, let's see some important terminologies which you need to know. Okay. See, what is chronotropy? Chronotropy all the time should remind you heart rate. Chronotropy means heart rate. Okay. Inotropy means contractility. See, this is heart rate. How many times the heart is contracting and how much powerfully the heart is contracting. That's the power of contraction. The power of contraction is myocardial contractility. If I say a positive chronotropic drug, for example, okay, see, digoxin, a positive chronotropic drug, what it will do? It doesn't increase the heart rate, but it increases the power of contraction. The heart is now contracting more powerfully. Okay, so inotropy means we are talking about the myocardial contractility. Dromotropy means cardiac conduction velocity, with how much speed the conduction is happening in the heart. And bathymetropy is cardiac excitability, how easy the heart is getting excitable, how easily we can excite it. Okay, so that's the bathymetropy. Okay, so I want you to know at least chronotropy, inotropy. These two are important terminologies which are like kept on coming. Chronotropy and inotropy are important. Okay, now after this, let's try to clinically integrate with the pharmacology. Guys, there is a drug called as ivabradine, ivabradine. Now name itself you can clearly say the bradine. Bradine means what? Bradycardia decreases the heart rate. Actually this ivabradine is a drug which decreases the heart rate, So when we are going to use it in all those conditions, whenever there is so much heart rate, we have to decrease the heart rate. So you can use a drug called as ivabradine. Now how this ivabradine is going to work, sir? See, ivabradine, it is a funny current channel blocker. Funny sodium channels or leaky sodium channels or funny currents. Okay, HCN channels. Now these HCN channels will be blocked by ivabradine. Now whenever the funny sodium channels are blocked, now sodium is coming into the cell. Now the entry of sodium into the cell, the funny current entry into the cell, it's taking a lot of time. Now what happens? Now slope is decreased. So from -60 to -40. Okay, from -60 to -40, it's taking a lot of time. It's taking a lot of time for the pre-potential to move towards the threshold potential. So what happens automatically? The action potential duration increases. So heart rate decreases. So that's how ivabradine is going to work. It's useful to reduce the heart rates in sinus tachycardias. Whenever there is tachycardia, you have to decrease the heart rate by giving the drugs like ivabradine. So it also blocks the funny channels in the visual apparatus. Actually, these funny channels are not only present in the heart, not only present in the SA node, but these funny channels, okay, HCN channels are also present in the eyes. So by using this drug ivabradine, VA, remember like VA means visual acuity is going to be decreased. Now just try to remember, see in the name ivabradine, VA is there, right? Ivabradine, VA means visual acuity, VISUAL, visual, okay, visual acuity is decreased, means the sharpness of the vision, or the vision is going to be affected. That's the side effect of this drug. Okay, so with this, we have discussed some important topics regarding the SA nodal action potentials and some clinical correlations. Okay, hope the video is helpful. Now, see you in the next video with a new topic. Thank you guys.